Welcome to another episode of Aware and Care, a weekly medical health show, an Ayurvedic perspective to take care of your health, your mental well-being, your physical well-being. We are in conversation with Dr. Ambika Nair every week, where she gives us lots of information about how to take care of our health. Everything starts with our home kitchen and home remedies many a times. Basically, it's all about diet. But we get many questions from our viewers talking about various health aspects that we need to cover. We've covered topics like hyperthyroidism and hypothyroidism. And one of our viewers from Bangalore has sent us this request that we need to speak about Hashimoto syndrome. We'll talk to Dr. Ambika Nair and understand what this problem is. First, let's welcome her. You know that she's a co-founder and chief consultant at Santhigram group of companies. Welcome to the show, Dr. Ambika Nair.
Thank you so much.
So, Dr. Nair, we are spread all across the globe, and I think wellness and well-being is part of our home, but the conversations are happening across the globe. And one of our viewers from Bangalore has sent us this message. We did cover about hyperthyroidism and hypothyroidism. Now, there's a question about Hashimoto syndrome, Hashimoto disease. Now, I'm sure you're the expert and you will give us a lot of information about it. And the moment we started talking about and spreading this information on social media that this week's topic is going to be Hashimoto syndrome and disease, we had so many viewers putting in their questions. Now, let's start with the basic. What is this condition?
Actually, it is an autoimmune disease.
Okay.
See, this means the patient's immunity itself will, start attacking the body.
Mm-hmm.
Immunity system means the immune system is supposed to take care of us by protecting us from the diseases.
Mm-hmm.
But here, it itself will become the enemy. Okay,
So,
it attacks the thyroid gland in Hashimoto. So it attacks the thyroid gland and, in which it affects the natural hormone levels. So when it is attacking the thyroid gland, then it affects a lot of, because that is the master gland, where it regulates so many things in the body.
Mm-hmm.
So, even with the patients with hypothyroidism also can get into Hashimoto, even hyperthyroidism also can get into Hashimoto, because it destroys the gland.
Destroys the gland. Okay, that's where exactly I wanted to understand.
Yes.
Because even as you were explaining, there's so many questions coming to my mind. So it is not hyperthyroidism, it is not hypothyroidism, but it is something that affects the gland by itself, the thyroid gland.
Yes.
So when somebody is affected by this, what happens? Do they see symptoms of hyper or do they say symptoms of hypo? Or there's a completely different
see, first of all, because in my practice itself, I have seen so many patients, because they were on hypothyroidism, they were on medication for a long time. So they tell that, doctor, because I was always taking even 100, doctor has increased my medication to 100 microgram to 125 micrograms. You see that, because now again, I feel so fatigued. Fatigue is the first thing what they say, that because they cannot move. See, you have to be active little bit to do an activity, right? So this is a total stagnation. You cannot move. That much fatigue, like a death. So this is what here, they will tell that, because then, then she had little bit of, the patients will have this difficulty in swallowing. Okay, even the water was getting, difficulty for her to drink. So these things, then they went to the, they will definitely go to the PCP. And the doctor was, they tried to do the blood test and everything. Then the ultrasound showed, CT scan, blood levels. So it shows that a Hashimoto disease.
Now, and you're explaining to me, yet I'm still a little bit more confused, and I'm sure many of our viewers who have this condition don't know a lot about it. Somebody like me who's still trying to understand, many viewers who have hyper and hypo, they may want to understand, this comes before the hypothyroidism or this leads to other things? The gland by itself is not functioning, and then all these things.
Anytime it can happen.
It can happen anytime. Okay.
It can happen with a Hashimoto, can lead to hyperthyroidism or hypothyroidism, or even it can lead to, both, vice versa.
So this is a treatable condition?
Of course, it is a treatable condition if the doctor is diagnosing. To diagnose is more important, mostly they will tell, they will misunderstand it to depression. Yeah, because you can see that there will be generalized swelling in the body.
Okay.
Okay, and some people will have like urination will be little less. Urination will be little less. Headache can be there. Weight gain will be there. Insomnia will be there, and depression, of course, fear, because they cannot understand what's happening in their body.
Yes.
So this is a fear psychosis,
Yes. Okay.
wandering mind,
Mhm.
because you were not like that till yesterday, and today what's happening? Why I was doing all my work, why I cannot move, why I
Mhm.
don't feel like doing anything, why I don't feel like cooking. For ladies, I'm telling.
Okay.
And it is seen actually in the mid age, like in mid 30s
Mhm.
or in the mid 40s,
Is
mostly
it?
in ladies,
Uh-huh.
mostly in ladies, but in men also it is there.
So,
The hormone changing time, that is there. And
okay.
some people will have only stiffness in the joints, severe stiffness in the joints, and
So,
swelling also will be there. Yeah.
so this basically you're telling me that this particular symptoms itself, people could get misdiagnosed, thinking that okay, it's just a headache, it's just thyroid, it's migraine or anything. But all these
Yes.
symptoms for in it could be an underlying condition. So, doctor, is
Yes.
there a possibility that somebody is taking medications for their thyroid and they are not getting themselves regularly tested? It does happen many a times that many of us are so careless after a certain point. We feel, oh, my doctor said so many mgs of this particular medicine, I continue with it for a long time, but regular testing is required. So because that's when you can also diagnose that it's an Hashimoto disease at some point, right?
Yes, yes. At least, once when you find at least these symptoms are there,
Uh-huh.
that you should know that there is some, like evolution is happening in your body.
Mhm.
So you should know that, like that you should take the help of a doctor and don't delay for such things actually.
No, and you did mention about fatigue and people are not able to do their basic work also. There's so much of, and I think it does lead to a lot of depression and a lot of chaos in your personal and professional life. So what happens to somebody who has delayed the treatment or in the diagnosis of Hashimoto? What is the
It,
worst
it,
case scenario? What
it
happens?
can be very fatal.
There's a little pause from my side because I didn't know how to react to that one. So, a patient goes to a doctor, and we are saying this is mostly middle age, 30 plus. So, children, teens, they are not so much affected with
Yeah,
this.
children also can have, like a Hashimoto can get into any age, but mostly I told you in 30s, in mid age.
Mhm.
Yeah.
And doctor, you always talk about the composition of the body. So, what kind of body types are more frequently getting this kind of problem in your
See,
experience?
Hashimoto sometimes it can lead to, like a kapha, like
Uh-huh.
a weight gain means a kapha related, or pitta related, like a very hyper, then, they are like vata and pitta.
Mm-hmm.
So, like their sleep is not good. High vata, their skin will be dry, very dry skin,
Mm-hmm.
and that their hair will be like standing, like a all
Okay.
brittle
Okay.
hair,
Uh-huh.
dandruff will be there,
Uh-huh.
crackling in the jaw, like in the feet,
Mm-hmm.
and chipped nails.
Mm-hmm.
Like their orientation itself will be like difficult to articulate with the speech itself.
And
Like a
I
very
think,
difficult condition it will be.
and so
And
at
like,
some point, at
yeah,
some point, I'm thinking that it looks also like menopause to women. So I guess people are always confused because that's when we delay our diagnosis, right? We think that this is menopause or this is just one of the phases of life and it's the weather related. And that's when the delay comes. So, friends, you're watching this episode of Aware and Care. We were talking about Hashimoto disease. It's a disease which affects the autoimmune system. And I think more details doctor is going to mention. So, you did mention initially that a lot of tests are done. So can we just go through them one by one again as to what kind of tests are required to diagnose this problem?
blood work they can go for like a thyroid, T3, T4, TSH.
Uh-huh.
The doctor will take care over here, and all
Mm-hmm.
those, blood work, hemoglobin. Some people will have very low hemoglobin,
Mm-hmm.
calcium level will be very low, because absorption will be very less.
Okay.
Yeah.
So,
And like some people will tell about the eye changes.
mm,
They will not have any other problem. They will only have eye changes.
okay.
Okay, so like a contraction of the eyelid. They try, and they want to close the eyes, but they find it difficult, as if it is getting like very stiff
Uh-huh.
to close the eyes. So the eyelid is not reaching there.
Mhm.
So that they open the eyes, and so many people it happens like that. So
So it
this
affects the vision?
all, Yeah, vision also will be affected,
Okay.
then swelling of the eyes,
Mm-hmm.
puffy eyes,
Mm-hmm.
and bulging of the eye, like eye bulging of the eyes will be there. Dry, gritty will be there, in the eyes, you can see some, like a small pus formations. This all these things, like all the very dirty eyes, we call it as.
Oh, dirty eyes.
Okay. And watering from the eyes,
Mm-hmm.
eye pressure, changes is happening in the eyes.
It's
So
obviously the
every organ it will
children.
be there.
Yeah. So,
High pressure, then some people will have photosensitivity, they cannot look at the lights,
okay.
they cannot go outside, even like a double vision will be there. Very.
Friends, as you're watching, some of you must be noticing that I'm smiling. It's not because of anything to do with these symptoms that Dr. Nair is mentioning. It is because every time doctor is mentioning certain symptoms at a different age group of viewers that we are, many of us are thinking, oh, I have that symptom. Oh, I have that symptom. We are constantly trying to relate and self-diagnose. But if you feel there is something like that happening, the best thing is to always go for your physical checkup, get it done on an annual basis. Now, Dr. Nair, is there a possibility that this is a hereditary thing or it just comes out of the blue for anybody?
Sometimes it will be like genetics are there.
Mm-hmm.
Okay, sometimes maybe other some diseases are there,
Mm-hmm.
complications are there, like not only with this Hashimoto is very common these days actually. Yeah. One case came to me by telling, I cannot walk.
Oh, okay.
I cannot walk.
Mm-hmm.
I told her what happens, like then the muscle catch is there.
Mm-hmm.
Okay. So the muscle catch and very puffy she became.
Okay.
It was a lady, that's what I'm telling.
Uh-huh.
Somebody was asking, you only treat ladies. No, I treat all age group, all
Mm-hmm.
genders, I take care. But some days, because ladies comes to a lot, then I
Mm-hmm.
talk like that.
So, friends, we'll be talking about Hashimoto today, and I think the symptoms and the aspects. It affects your butterfly gland, that is your thyroid. It attacks that, that is the main organ. Of course, after that, the entire system gets messed up. And please go for a blood test, like doctors mentioned. And once the diagnosis is done, the treatment process will start. Now, Dr. Nair, when you talk about Hashimoto, what is the treatment scale? I mean, what is the timeline of this treatment apart from the body composition?
Yeah.
Do people start seeing the difference in 1 week or 15 days? What is the
Oh, why
average time?
not? They will start seeing the difference in like 3 days.
3 days. Wow, that's great.
Yeah, because I will tell you are grilling certain stamps.
Mhm.
Like why I tell you, because all the cases, they are, I have treated a lot of cases.
Mhm.
So they tell because the response was very good actually. Hashimoto,
Mhm.
like the diet we will be telling them,
Mhm.
lifestyle changes,
Mhm.
and Panchakarma, of course, we did for these
Okay.
people. And like in 72 hours. So I tell that okay, it will take 1 month, but like in few days they started seeing like the difference.
I
That
really
that
want to plug
smile is something different. Yeah.
Yeah, I really want to plug in a thought here, friends, that many of you think that there's a myth that Ayurveda is a long-term process, but yes, we just
No.
got the doctor on time. She says you are literally seeing, hope and results in 3 days. But for that, you have to follow whatever is being prescribed to the patient, and they have to follow that strictly. Now, so let's get to the understanding what kind of diets are recommended for patients with Hashimoto.
See, it all depends upon what constitution they are.
Mm-hmm.
Sometimes we see on examination, we see that there are so many nodules over there.
Mm-hmm.
Okay, so, like a lifestyle changes will be there. And definitely we will be explained, like telling them to do little yoga,
Mm-hmm.
physical activity. This is like, like, see, one old car is, stable for a long time,
Right.
parked for a long time. So you want to restart the car.
Mhm.
You know that every system has to be greased up.
Absolutely. Yeah.
Hashimoto is like that. You have to grease up everything. First itself is motivation. You are going to be perfectly all right. So the gear is in the mind.
Right.
So you accelerate it. You keep on changing it. And you have to be with them constantly. You have to talk to them. They are very nice people. Actually, they lose the hope because they were on medication for a long time. Instead of becoming, like a hypo, then it became Hashimoto or hyper, then they come in panic. Actually, very anxious they will be.
No,
And
that's a good
anger also.
You mentioned a good point that they are on certain medications at that point. But when Hashimoto is diagnosed, do they continue with their thyroid medicines, or they're usually stopping that medicines and it goes independent treatment for
No,
both?
no, 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 no. See, nowadays, Madhavi, stress is another factor.
Uh-huh.
So much of, very competitive world, stress, stress will, like make changes in the body.
Mhm.
So that is one of the reasons I have seen that, how, like, because they have to meet all the targets. So
Mhm.
people are like running around just for that. They don't have any time to sleep, any time to eat, to do anything for themselves. So that is actually one of the factors which leads to all these diseases.
So in this case, it's the triggering factor
They
is
will.
mostly stress,
So, no, I'm telling, like if they were on thyroid medication,
the thyroid
and when
medications.
they
Okay, I
get
got.
into, and they
Mhm.
will continue with their medication, and their doctor itself will reduce their medication.
Mhm.
After this, like once they get into this treatment from Ayurveda, their doctor itself will change the medication, and they will tell them, oh, like we get a lot of compliments.
Yes, that's right.
Yeah.
So, Dr. Nair, there are so many, subsidiary problems that come with any disease or any condition. I do want to touch base on this subject very delicately and lightly. There's also the misconception, or there is a fact, I'm not sure you would be the right person to tell, that people fear cancer also, cancer of the thyroid. Is there
Of course.
any connection? Because I see a question also coming up there.
That's what I told fatal. I didn't use the word cancer,
Mhm.
but
Mhm.
it can be very fatal if they don't take care because it destroys the gland actually. Yeah.
So, is there an artist? What kind of surgery or other things also recommended when
At
the
that time, they
gland
will do
itself
the
is
surgery
destroyed?
because that management in Western medicine it is entirely different. You understand, no?
Uh-huh.
But not for getting it there. That they should take care of their own body.
So if you catch it at the right time, you can avoid all the other fatal aspects that
Yes,
we are talking about.
100%. There is no doubt in that.
So
First of
let's
all,
also,
eating habits.
yeah, that's where exactly I was trying to come to that. Okay, the eating habits all have to start from the beginning. New moms and children and puberty hit kids or adults, we all have to change our eating habits to avoid all these problems and see that we see less of Dr. Ambika Nair. She'll be the happiest if we don't see her, but we are getting these problems and we have to meet our doctors and get to understand that. So what kind
Ma-
of diets are recommended for
yeah,
patients?
Madhavi, people come and ask me, can we eat pasta? Can we eat pizza? Because actually, I face all these things.
Uh-huh.
Okay, so they can eat pasta. I don't tell them not to eat pasta. But everything, like it should be in moderate. Nothing excess.
Mhm. Yeah.
If it is not digesting, which is making a disease in you, then why
Mhm.
you want to eat that? It's like a poison then to the body. So I make them understand.
So basically, a week of treatment and 2 days of pasta. Again, you're retreating by at least about 3-4 days of your treatment, I guess.
No, no, no. Actually, we will tell them they can use a rice pasta is good, like not with
The
anything
options
with the
available. Yes.
all-purpose flour. Pasta is also a good diet. But
Uh-huh.
only problem, whatever you put, it should be fresh things.
Hmm. Right.
Okay, and if there's so much, cheese is being put in that, and if it is not getting digested for you, then
Hmm.
again your cholesterol only will go high. It will affect your liver. So, understanding, making them understand. Even children, they are more, like inclined to know about Ayurveda a lot when I teach them.
Hmm. So, Doctor, as you're mentioning about diet, let's also touch base on what foods or what kind of diets trigger Hashimoto. The symptoms increase because of certain
Actually,
foods.
like a cauliflower, all these cruciferous vegetables,
Yes.
I don't allow them to eat, whatever it is. Okay. But then, because it depletes iodine and calcium and iron will never get absorbed in the body. That is another thing.
Mm-hmm.
And another thing, like because people eat a lot of like only egg, 14 eggs, 15 eggs and all per day. That is not actually your digestive system. If your digestion is good, you can eat any damn thing. But if it
Mm-hmm.
is not good, your acne is very acne mandhyam, we call it. Acne mandhyam means you will get into major issues.
Mm-hmm.
Only cooked food, I tell them, if it is a vata person.
Okay.
Kapha also, kapha, we will tell them not to eat any raw salads and all. And these, fruits, banana, grapes, all those things we don't allow them to have. till the mucus comes down, because they will have focus issues, memory will be, like disorientation will be there. Some people, like a very bad, like because they will get dizziness also when they stand and all. Okay, some days buzzing in the ear, tinnitus will be there. It's a very big subject actually, even
So
though we say that it is only Hashimoto's.
yeah, that's exactly. So there are so many symptoms which are coming up when somebody is going through this condition, subsidiary or underlying health conditions. They could have high triglyceride or cholesterol, or they're diabetic. Now, people are taking multiple medications for different problems. Now, if they come for a treatment, do they have to stop the medications, other medications that they're taking, or it goes hand in hand?
No, first, because actually, especially, like this cholesterol, this is a very good question actually. Because we know, like when they come, we do the panchakarma means, afterwards they will go for their blood work. So their doctors will be amazed to see that their cholesterol, they will tell no need to take the cholesterol medications. Like your fatty liver was there, now nothing is there. So all these complications are down. Triglyceride was high, that is fine. Your HDL, LDL, everything is in balance now. Your A1C was very high, now it is perfectly normal. So
Mhm.
these all the things, so it is a detoxification, panchakarma. So when the detoxification happens, all the like cells in the body is
Mhm.
getting cleaned up. So it is a total regeneration internally and externally.
Doctor, in the starting, you mentioned that stiffness of joints and joint pains also happen. So I see a
Yes.
question coming up. Is gout also related to Hashimoto, or they are two different problems?
Gout will be there because actually, like they can get into osteoarthritis also with this. Okay. And even gout also because
Mhm.
see, they will be eating a lot of, like seafood
Mhm.
and lot of chickpeas, high proteins. And when it is not getting digested, all accumulation on the body. So naturally the uric acid will go high. Okay, they will have breathlessness. Maybe their creatinine level is on the higher side. So all these complications are very, very possible actually.
So we were talking about Hashimoto syndrome and disease, and we spoke about all the symptoms that are there and other aspects. We also talking about treatment here. But doctor, I did hear you saying a couple of times talking about panchakarma and what about medications are also involved?
Of course, medications are absolutely necessary.
Mm-hmm.
Yeah, herbal medicines, not other medications. Okay, we'll
Mm-hmm.
be telling them with the diet itself, 80% will be better. And
Uh-huh.
some helps, like maybe 1 month, 2 months afterwards, it will reduce. Okay, some people have like a very, very bad symptoms, maybe they will continue for a little more time. It all depends upon the case.
It depends. So, for the first thing is getting it diagnosed and understanding your body type for any kind of treatment to happen. And once again, friends, we've been mentioning this in every episode that please do not try any of these remedies at home. First, get your body composition found out from the doctor as to what kind of body type you have, and medication and diet is accordingly given by Dr. Nair and her entire team at Santhigram. So, doctor, a patient has come. We've already, I think, covered most of it. They start coming for the treatment. What kind of this panchakarma that we talk about, is it weekly, bi-weekly? What is the schedule for that?
But it all depends upon the condition of the person again. 1 week, maybe. Hashimoto means 100% we will give them 3 weeks treatment.
3 weeks treatment. Okay, that's
Yeah,
21 days.
because actually sometimes Uddhavardhana has to be, I told you if it is kapha related and because there are so many videos has to be done, we have to see how they will be responding.
Uh-huh. That is a very interesting aspect that you've mentioned, doctor. So during the treatment, can person continue to go to work or do the other activities, or request them to have a complete rest of the body?
You are asking very beautiful questions today. Yeah, they can do actually because here, everybody has to work,
Uh,
right? So, like I tell them, they will, they can some, if it is very like fatigue or anything like that, then they will take few days leave. Outstation patients will come and they will take leave and come. But IT people, they can work anywhere. So after the treatment, they will be sitting and working.
yeah, I think you're absolutely right, because we are not talking about hardcore labor work, right? Climbing the mountains or lifting heavy
No, no,
weights. We're
no,
just
no,
talking
no, no,
basic
no.
rested. So that's fine. You can continue to work while the treatment at
Yes.
Santhigram is happening, whether it's through Panchakarma or through medications. Many a times our viewers are asking this question because there is always this myth that you are completely to be rested. But once again, like Dr. has mentioned, it depends on your body composition, what kind of treatment is recommended. And when something is recommended, people have to follow to get the instant results or results in soon. So, doctor, have you covered most of the aspects of Hashimoto that you feel that something is missing or that you would like to share with our viewers today? Anything to do with exercises and pranayama?
Exercises, if you don't feel like doing something else, so at least do the breathing exercises.
Mhm,
Try to stretch yourself, because
mhm,
without mobility, you have to be active. Your heart also has to be active.
mhm.
Okay, if you don't activate anything, if you lie down, again it is a very big depression. Never do such things, you will put on a lot of weight.
So, and are the weather changes any affecting the patients with the Hashimoto?
Definitely. But the changes means they will complain of joint pain.
Mhm,
Okay, they don't like to, oh, okay, I forgot. You asked a very good question.
mhm,
Because actually it affects the hormone levels. What will happen, they cannot tolerate the weather, especially the winter.
mhm.
They feel so cold, so cold. And that is another thing. Thank you, Madhavi, for making me to tell that. Okay, because actually they will feel very cold. Extremities will become very cold. You can see that even they know that it will become bluish even in color.
Oh, okay.
Yeah. So they feel very cold. That's one of the reasons they don't like to go out. They cover themselves, they protect a lot. If you have thyroid, and some people will get, breathlessness and all those things, you have to take care of yourself. Cover your head, cover your feet. And, plug your ears when you go out, because these are mandatory things, especially in winter.
So, Dr. Nair, we covered most of the aspects of Hashimoto and the treatment process and the support. Coming to support, I do want to check with you one more time. Many a time, patients go alone in the treatment process. They feel that they do not get any support anywhere because it's a different science that we are talking about. And unfortunately, this is a science which is in our roots. Healthy living, healthy lifestyle, healthy food is in our system. Yet, many a time, patients feel very alone during the treatment process. I want to hear a few words from you about the support function when a patient is going through treatment.
Actually, family support is more important, actually.
Mhm.
Like we call the husband, because even though here everything is alone, but
Uh-huh.
like I tell them, because most of the Indians only come to me,
Uh-huh.
and not only Indians, I'm telling, because actually family I'm talking, and
Okay.
even a lot of Americans, lot of other people come to me. There is no
Mhm.
problem, but like the family is a big support. That is the backbone. They feel that they are needed for the family.
Mhm.
Then only their mental, like strain comes down, fear goes away, they feel they are wanted. So that is more important, actually.
So beautiful.
Very, very. And the children, some children, because they have some behavioral issues and all, they don't listen. So this all gives a stress to the mother also, and whoever is the sufferer. Okay. So we, like we tell, you have to support your parents. We call them.
Uh-huh.
I give counseling, actually.
That's very important. Friends, you just heard, I do understand that there is, the question about privacy and independence and everything that comes about. But when a person is sick, I think that's when you realize that what is most important is love, care, affection, and support, apart from medications. Medications do their job, but the support function is also very important. I'm sure you got your message from Dr. Ambika Nair. Thank you once again, Dr. Nair. It is always a delight to be hearing from you and, listening to all these beautiful tips, suggestions. And it feels like a family to family talk because most of the remedies are from the home, from your kitchen, from your home gardens. Basically, healthy food habits, healthy thinking, healthy living. Thank you so much once again for this episode and your final words to our viewers.
This is winter season. Drink only warm water.
Mhm,
Okay, you can take, like, because if, sometimes, because of the winter, there can be constipation.
mhm,
Take 1 tablespoon of castor oil every day at night. If you don't like the taste, at least take 1 teaspoon.
uh-huh,
So that will make a lot of changes. And take steam.
right.
If you feel any, like breathlessness or anything like that, take a steam fast.
So we
Okay.
will let you go on that note on castor oil, which is always part of a conversation here on Aware and Care. Thank you so much, Dr. Nair. I'll see you in the next episode.
Thank you.